Thank you, Kakaki. Please, can we have the national anthem? Thank you. Can we take our seats? Thank you very much. The Vice Chancellor, sir, our invited guests, the management of the university, you are welcome to the 10th Inaugural Lecture to be delivered by Professor Danladi Adamu Bojude. May I invite the chairman of the organizing committee, Professor Mohamed Guramaduku, to come and give his opening remarks. Thank you.
the Vice Chancellor, Gombe State University, Professor Aliu Usman El Nafati, Principal Officers of the University, visiting Vice Chancellors, distinguished members of the University Senate, the inaugural Professor Danladi Adamu Bojude, distinguished ladies and gentlemen, members of the press, good afternoon. On behalf of the Vice Chancellor and members of the University Ceremonies Committee, I would like to welcome everyone to the 10th Inaugural Lecture of Gombe State University. This 10th Inaugural Lecture is going to be given by Professor Danladi Adamu Bojude, from a professor of epidemiology and community oncology in the Department of Radiology, Faculty of Clinical Sciences, College of Medical Sciences, Gombe State University. He is also making history today here, being, I'm not sure about I think he is the first from the clinical sciences, and certainly the first in his own field of specialization, community oncology. Mr. Vice Chancellor, sir, ladies and gentlemen, this, as I have always been saying, inauguration lectures are meant or are done traditionally by universities around the world for newly appointed or promoted professors of established chairs. And today we are having this Professor Bojude, and I believe we are going to benefit from his wall of experience, his research, and his entire academic journey, which he is summarizing here in this afternoon for us. So let me take the opportunity to respectfully invite the Vice Chancellor to give his opening remarks before we go into the main event properly. Mr. Vice Chancellor, sir.
The members of University Governing Council here present, visiting Vice Chancellors from the Joel University, also the Northeast State University and the Federal University of Kashiri, our distinguished visitor, who is a mentor to the lecturer today, Father Professor Tajuddin Olesinde, all the way coming from ABU Zaria, you are welcome. The Deputy Vice Chancellor Administration, Deputy Vice Chancellor Academic, the Registrar, the University Librarian, and the Bursar, Deans, other professors, heads of departments, the Chief Medical Director of the Teaching Hospital, Provost, and other invited guests. Ladies and gentlemen, good evening. It's my pleasure to welcome you to this 10th inaugural lecture and the second coming from the College of Medical Sciences. And of course, the first from the department, what we call radiation oncology or the oncology services. This is a very important occasion for us that we're having our professors from the college deliver inaugural lectures. And of course, this our lecturer today is going to tell us what he has done in terms of clinical oncology, community oncology, and all of whatnot. I hope and I pray the audience who are not those medically related will be able to follow up the presentations because of the terminologies that he may be using. I hope we're going to simplify it for us in such a way to be able to follow the lecture. So, ladies and gentlemen, not to take so much of your time, a very important event. And hope all of us are going to listen and be able to carry something at the end of the day in terms of what this our distinguished scholar has accomplished through his academic life and professional life to date. So, ladies and gentlemen, thank you very much for coming and spending your time to come for this important lecture. And I wish you all a very good listening to the lecture. Thank you very much.
Thank you very much, sir. The Vice Chancellor, Gombe State University, Professor Ali Usman El Nafati. Thank you once again. Can we give him an applause, please? Thank you. Next, we are going into the event of the day. May I call on the inaugural lecturer, Professor Danladi Adamu Bojude, to come up here. May I also call on the university orator also come over here so that you cite it. The university orator is going to cite his citation for us. May I remind the guest speaker that you have 40 minutes to deliver your lecture. Please bear with the time. Thank you very much.
The Vice Chancellor, Gombe State University, Professor Ali Usman El Nafati, Officer of the Federal Republic, the Deputy Vice Chancellor, Professor Danladi Umar, Vice Chancellor Administration, Deputy, the Deputy Vice Chancellor Academic, Professor Sani Ahmed Yauta, the Registrar, Dr. Abakar Bafeto, PhD, the University Librarian, Dr. Henry Maina, the Bossa, Mr. Zephania Shehu, the Chairman, University Ceremonies Committee, who doubles as the Dean of the School of Postgraduate Studies, Professor Gurama Duku, the visiting Vice Chancellors of Northeastern University, represented by the DVC, Dr. Sani Isiaka, Provosts, Deans and Directors, Heads of Academic Department, distinguished professors and other University Senate members, Professor Tajuddin Olasoinde, Professor and Consultant Clinical Oncology from the Premier University of Northern Nigeria, ABU Zaria, the Chief Medical Director of the Federal Teaching Hospital, Gombe, Dr. Yusuf Muhammad Abdullahi, and the dear family of our distinguished inaugural lecturer, other administrative and technical staff of the university, our dear postgraduate and undergraduate students, ladies and gentlemen, I have the singular honor to render the citation on Professor Adamu Danladi Bojude, MBBS, MSc, PhD, FMCR, FWACS on the occasion of his inaugural lecture as a professor of this beautiful university. Professor Danladi Adamu Bojude was born in Bojude town on the 4th of March, 1974. He attended Bojude Primary School, Comprehensive Secondary School Bojude, and Government Science Secondary School Toru, Bauchi State, obtaining the primary school certificate and secondary school certificates in 1986 and 1991 respectively. For his tertiary education, he proceeded to the University of Maiduguri and obtained the MBBS in 2004. He served as house officer in FMC Gombe from 2004 to 2005 and did the NYSC at State Hospital Oyo in Oyo State from 2005 to 2006. Danladi Bojude was medical officer in State Specialist Hospital Gombe and General Hospital Deba in 2006 before joining the defunct FMC Gombe as resident doctor in the Department of Radiology in the same year. He was sent to the University College Hospital Ibadan as pre-numerary resident for postgraduate training in clinical oncology and commenced the program in January 2007. He became a fellow of the National Postgraduate College of Radiology and fellow of the West African College of Surgeons in the Faculty of Radiology in 2011. In January 2011, he was admitted into the prestigious University of Ibadan and earned the MSc in Public Health with specialization in epidemiology and medical statistics in 2012. He returned to FMC Gombe to start a new cancer center before proceeding to Max Cancer Center, Mass Multi-Specialty Hospital, New Delhi, India, in 2013 for fellowship in medical and radiation oncology, where he visited Taj Mahal in Agra. He was selected for 4 international Atomic Energy Agency fellowship in clinical and radiation oncology at the National Cancer Institute, Cairo, Egypt, between 2015 to 2016. Professor Bojude was at the famous Egyptian Museum and the historic Great Pyramids of Giza, where he saw the historical development of one of the most famous world civilizations. Professor Danladi Bojude was first appointed by the Gombe State University in 2012 as a visiting lecturer in Biostatistics, Department of Community Medicine, and in 2016 he became a senior lecturer in the Department of Radiology before rising to the coveted rank of Professor of Epidemiology and Community Oncology on 1st October 2021, after successfully undergoing the requisite assessments and evaluation. In 2017, he was selected for the highly competitive Commonwealth Scholarship Commission Award for PhD in Epidemiology with specialty in Population Health Science Studies at the University of Edinburgh, United Kingdom, after which he earned the Doctor of Philosophy in 2022. While at Edinburgh, he attended several academic and leadership courses, meetings, workshops, and conferences across the United Kingdom and abroad, which attests to his versatility and scholarship. He further attended several short courses within and outside Nigeria, which include the virtual courses such as Reproductive Health, From Advocacy to Action, and Basics of Health Economics, both sponsored by the World Bank Institute, Washington. He also attended the Implementation Science Training with focus on infectious diseases of poverty by World Health Organization, UNDP, UNICEF, TDR African Regional Training Center. Professor Bojude was also a participant at the master course on advocacy for improved cancer control and craftsmanship and mentorship workshop. Professor Danladi Bojude was appointed HOD of the Department of Radiotherapy and Oncology, Federal Teaching Hospital Gombe in 2014, and on multiple occasions served as Deputy CMAC Research and Training in 2022. He was further appointed Director, Institute of Health Sciences, FTHG, in 2023. He chaired several committees, such as technical committees for the establishment of School of Dispensing Opticianry, School of Health Information Management, and School of Community Health Officers Training Program in Federal Teaching Hospital, Gombe. In addition, Professor Bojude was selected as a ministerial committee member, National Cancer Control Steering Committee, Federal Ministry of Health, Abuja, in 2016, where they developed the 2018 to 2022 National Cancer Control Plan and provided technical guidance on its implementation in the Federal Republic of Nigeria. Between 2020 to 2023, he chaired the African Organization for Research and Training in Cancer, Subcommittee on Research Infrastructure, Collaboration, and Resources within and outside Africa. Professor Bojude is currently a research fellow, National Institute of Medical Research Foundation, Yaba, Lagos, and currently working to improve HPV-based self-sampling at community-based pharmacists and PPMVs among women to prevent cervical cancer. He is also serving as the Dean, Faculty of Allied Health Sciences, Northeastern University, Gombe. He is a member of many prestigious societies, such as the International Society of Global Health, African Organization for Research and Training in Cancer, International Cancer Screening Network, Cancer and Primary Care International, Nigeria Infectious Disease Society, Epidemiological Society of Nigeria, Nigerian Cancer Society, Association for Radiation and Clinical Oncologists of Nigeria, among others. He has several collaborative researches with institutions and groups within and outside Nigeria, notably the University of Miami, Northeastern University, and several health institutions. Professor Danladi Adamu Bojude consulted for USAID and DFID, supported community-based maternal, neonatal, and child health sciences evaluation in Gombe and Adamawa State that attracted Bill from Melinda and Bill Gates grants. He is a reviewer of manuscripts for national and international journals, for example, PLOS ONE, Infectious Diseases and Cancer, Cancer Medicine, Journal of Radiation Medicine in the Tropics, and Nigerian Journal of Medicine. He was also the past editor-in-chief, Nigerian Journal of Oncology, and editorial assistant, Gombe Medical Journal. He has supervised MSc, PhD, and fellowship dissertations, and has to his credit over 30 peer-reviewed publications in local and international journals. He enjoys walking, reading, football, traveling, current affairs, and movies. He is happily married and blessed with children. May I invite him to present his inaugural lecture on this important day. Thank you so very much.
You may need this.
Okay. Thank you, Mr. Vice Chancellor, sir. The Vice Chancellor, Professor Ali Usman El Nafati, OFR, the Deputy Vice Chancellor, Administration, Deputy Vice Chancellor, Academics, the Registrar, the Bursar, the University Librarian, my Provost, College of Medical Sciences, Deputy Provost, the Dean, School of Postgraduate Studies, the Dean, Faculty of Clinical Sciences, Deans of Faculties, Directors, distinguished members of the University Senate, the head, that's my head of Department of Radiology, and other HODs in the university, management and staff of other universities, your Royal Highnesses and Majesties, eminent colleagues, academic, non-academic, and professional, representatives and members of professional and staff unions, my parents, family, and friends, invited guests, dear students, depressed, distinguished ladies and gentlemen, good day. Mr. Vice Chancellor, sir, I'm going to present my inaugural lecture. This inaugural lecture is actually a celebration of my stewardship in three parts, mainly celebrating my careers and community services beyond community oncology, and also contribution to practice and knowledge, and also celebrating and appreciating, as well as acknowledging those that nurtured me, supported me, taught me, and guided me. Mr. Vice Chancellor, sir, it is an immense honor and privilege for me to deliver this inaugural lecture titled Community Oncology, or Championing Community Oncology, Saving Lives and Empowering Communities, to my distinguished colleagues, university community, family, friends, and the general public. Mr. VC, sir, I want to start with this African proverb that says it takes a village to raise a child. It also takes a community to raise a child. As we all know, our children are not only raised by us as parents, but also by our grandparents, by our relatives, by extended family, teachers, and everyone in the community. And that is what is also obtainable for community oncology. I was actually inspired by this African proverb. Mr. Vice Chancellor, sir, I want to also present the first part, which is the introduction of my lecture, essentially in 4 parts. But before that, I want to also tell the general public that community oncology is also same thing as primary healthcare oncology. It's also the same thing as primary care cancer care, as well as community-based cancer care. Mr. VC, sir, my introduction is going to be in these 4 items: background of community oncology, highlights of community oncology services, models of community oncology services, and key examples of communities with prominent community oncology services in Africa. But I want to begin by giving all the glory and gratitude to the Almighty Allah, the ever-living, the sustainer of all, the most gracious, the most merciful, for giving me the opportunity to stand before you today to deliver the 10th inaugural lecture. Mr. Vice Chancellor, sir, every 1 minute, 2 women die and 1 man dies of cancer globally, making cancer one of the greatest threats to our health and livelihood. Each of these deaths are tragedies that are preventable, especially from cervical cancer. Unfortunately, most of these deaths are in sub-Saharan Africa, mostly affecting our women in the prime of their lives, with Nigeria at the center of it due to its large population. These women are raising children, caring for their families, and contributing to social and economic fabric of their communities. And most of these women, unfortunately, are not diagnosed early enough and lack access to life-saving treatment near them. But it shouldn't be that way. If we had improved access to cancer diagnosis and treatment at the early stages, using innovative strategies and technology embedded in strong health system in our communities. And as such, we actually need to bring everyone on board, and everyone through collaboration and partnership to achieve this goal. Mr. Vice Chancellor, sir, last month on June 28, 2024, Nigeria officially declared cancer a notifiable disease. This landmark declaration marks a crucial advancement in the nation's efforts to address the escalating cancer crisis. And Community oncology is a practice of cancer care in the community, as I earlier said. It ensures that people have access to quality and affordable cancer preventive services and treatment in their local communities where they live and where they work. It is based on WHO concept of universal health care, which means that all people have access to full range of quality health services they need where they need them, without financial hardship, including full range of health services from prevention, promotion, treatment, etc. Mr. Vice Chancellor, sir, unfortunately, the world is actually off the road to making considerable progress towards universal health care. And unfortunately, despite all the advances in health services coverage has actually deteriorated, including for cancer care. And as such, people are facing a lot of catastrophic out-of-pocket payment for health services. As you know, with the removal of subsidies, cost of healthcare has actually continued to increase. And this is not just in Nigeria, but actually across the world, especially in low and medium income countries. And with billions of people going deeper and deeper into extreme poverty due to health costs. And in view of these rising costs and competing demands, cancer has a lot of competing demands: malaria, HIV, and recently COVID-19. So the WHO's recommendation is to reorient the health system using a primary healthcare approach. And all of these essential universal healthcare services intervention can be delivered through primary healthcare approach, just like cancer. With that, that will lead to increase in life expectancy, and hence the need to actually champion community oncology. Mr. Vice Chancellor, sir, we all know that most African countries can actually not afford some of these goals due to weak health system, limited resources, and some of these competing demands. For example, there are only 10 cancer centers in Nigeria. With a population of about 200 million people, that brings 61 cancer centers to 20 million people. In the whole of Northeast, there is one complete cancer center, which is the one in Maiduguri. We have one here, but do not have all the services that is needed. And so people now have to travel from all the extremes of Northeast. Actually, the cancer center in Maiduguri caters for the whole of Nigeria, because most of the centers are actually broken down. So what does that mean? People have to travel long distances, spending a lot of money, losing employment, losing jobs, spending a lot. They have to come and stay for a long time in Maiduguri, average 2 to 3 months, with a very high cost of treatment. All this actually affects the patients. Actually, there should have been one cancer center to about 250,000 or 500,000, but that is what we don't have that. However, communities in Africa have a noble culture of communality, kinship, and interdependency, which we all know. Whenever you are in trouble, your relatives, your friends, and everyone comes to your help, and that is what is needed. And therefore, realizing and harnessing some of these embedded practices in our community actually lead to very successful community oncology services in Africa. And community oncology services is all about collaboration and partnership. Partnership between health workers in the community, community-based organization, traditional rulers, religious organization, volunteers, and everyone in the community. One advantage of community oncology is that it actually demystifies the typical cancer care that you see in teaching hospitals and in big cities. It brings it down to the community. Another advantage is that it runs across all the cancer control continuum. Cancer control continuum, from prevention to survivorship, diagnosis, community-based diagnosis, community-based treatment, survivorship, end-of-life care, psychosocial care, including navigation. The practice also is based what we call task shifting, by empowering lower cadre health workers, like community health workers, with useful skills that leads to reduction of gaps caused by factors such as inadequate skill manpower. We only have a Betara Cancer Center in Maiduguri and FTH program to serve the whole of northeastern Nigeria. The second item in my introduction is highlights of community oncology services. Mr. Vice Chancellor, sir, this ranges from prevention and advocacy services. Example, cancer education and awareness at the community level through one-on-one interaction, group education, mass media, small media, pamphlets, brochures, TV, radio, all with the aim of overcoming barriers to screening, early detection, encouraging early detection and treatment. It also includes risk reduction measures like vaccination for infectious diseases like hepatitis, including HIV prevention. We can also talk of physical activity, diet support, alcohol control, and tobacco control. Also, community-based screening and early detection, especially for CA cervix, the screen and treat method using VIA and VLI, but also for prostate cancer, breast cancer, liver cancer, etc. It also includes community-based diagnosis. Usually, diagnosis is usually carried out at the big hospitals. However, we can also empower general practitioners, nurses at the community level to actually provide, even if it's a minimal diagnosis, that can then subsequently be actually either supported or verified by the teaching hospital. Mr. Vice Chancellor, sir, treatment can also take place. We know surgery, radiotherapy, chemotherapy, targeted therapy, and several forms of treatment is usually in big centers. But some of the centers, at the community level, even minimal can actually be done. We can give chemotherapy at the community level by GPs, by nurses, supported by community-based pharmacies, and some other ones. In fact, radiotherapy services can also be given in a community. I will give you an example of a community in Cairo with all the services that is obtainable, survivorship and surveillance in the community, and usually after treatment, surveillance for recovery. Includes partnership and collaboration across communities in low and medium income countries. Due to diverse socio-cultural practices and lifestyles, diverse environmental exposures and genetic backgrounds, and research can bring all this information for the support of our people in the community. The models of community oncology services, home-based care. Home-based care. We know we can carry out community oncology services at home, counseling, psychosocial support, even screening, HPV self-sampling can be done at home. Someone having diarrhea and vomiting can be supported at home without having to go to the hospital. The patient does not have to go back to maybe Meduguri or come to Gombe from distant communities. We can actually work with community-based GPs and nurses and all the other health workers to actually support that. It can also be done in our private hospitals across the communities, GPs, community-based PHCs, or even we know our community, especially religious organizations, they have their hospitals. They have, in fact, some even have cancer centers. All can be used to actually support community oncologists. The key example I'm going to give here is the Bahia Hospital and Foundation for Cancer Early Detection and Treatment for Women Cancer. I was in this hospital. This is actually owned by community completely. Bahia Wahab is a patient, breast cancer patient in Egypt, and she had to go abroad for treatment. When she came back, she said it shouldn't end with her. So she informed her children that I want a foundation for cancer support in my name so that other women can also benefit from services I got abroad. And the first building here, you can see, I was in front, you can't see me very well because of my dark skin. But inside is almost a 7-story building. When it came up, someone donated this building, and all he's asking is 1 Egyptian pound as a rent every year per annum, just 1 Egyptian pound, which is about 30 naira to 40 naira as his own contribution. And people got inspired and also provided a lot of all the state-of-the-art cancer treatment and prevention services, free. In fact, I had a patient from Gombe, a lady that was there, and she was treated free. That led to a lot of success, and then they also have another one. The first one was around Giza Governor, and then we have another one in Sheikh Zayed. The Kailisa township in South Africa, in Cape Town. Kailisa is a very poor community in Cape Town. This screening project is actually led by the late Professor Lenny Denny from the University of Cape Town. She is a consultant gynecologist, obstetrician and gynecologist. And they've done a lot of work. We know there is very high level of HIV in East and Southern Africa. And that led to a lot of cancer of the service cases. And that is why she started this program. The Bamenda Cameroon, because of Cameroon Baptist Convention Health Services, they are doing a lot of work. They are doing a lot of work in cancer screening and control. And also our own here in Gombe, the Papillomavirus Society of Gombe, Nigeria, ably led by my provost, Professor Mohammed Manga, and the Nigerian Cancer Society Gombe State Branch. We are all doing a lot of work regarding community oncology. Mr. Vice Chancellor, sir, about my careers and community services, which extend beyond community oncology into academia, clinicals, research, training, administration, and volunteer work. I want to start with my community oncology practice, and I want to start here in Gombe. First, as my role as Vice President of the Papilloma Society of Gombe, Nigeria, also a member of the Multidisciplinary Tumor Board and Gombe State HPV Vaccine Technical Working Group. We know there was a recent vaccination of girls in secondary school from the age 9 to 14. It was a huge success with about 95% uptake by the Gombe State Primary Healthcare Development Agency and the Gombe State Ministry of Health. The Papillomavirus Society of Gombe, on the 4th of March here in this hall, recorded a huge successful International Human Papillomavirus Awareness Day, themed One Less Worry, and so on. As a ministerial committee member of the National Cancer Control Steering Committee in the Prevention, Advocacy and Social Mobilization, we developed the 2018-2022 Cancer Control Plan and supported its implementation. At the level of the Nigerian Cancer Society, I was the chairman, NCS Gombe State Chapter, and at the national level, past medical and scientific officer and assistant publicity secretary. Most of the work we did was all around cancer community oncology, promoting education, awareness, and so on. And I also serve as work group chair, Research Infrastructure Resources Collaboration Committee of the African Organization for Research and Training in Cancer. And I'm a research fellow of the NIMA Foundation, that is Nigerian Institute of Medical Research, Yaba, Lagos, with a grant support to promote human papilloma-based sex sampling uptake at community-based pharmacies and patent and proprietary medicine vendors. We know chemists, as we call it, or pharmacists, they are everywhere. They are on all our community, streets. If you go out of Gombe State University, in each direction, you see many pharmacists. They are there 24/7, from morning to evening. Some of them even support you overnight. And what they do, we are trying to explore and leverage on them to see how we can increase uptake of screening and control of cervical cancer. And I was also a member of the Cancer and Primary Healthcare International and International Cancer Screening Network, where I support the cervical cancer working group and that of screening in the COVID-19 era. At the level of Nigerian Medical Association, we've done a lot of work, especially in the World Cancer Day and the outreach. And also in my Association of Radiation and Clinical Oncology, I've done a lot. In fact, I was a keynote speaker in Radisson Blue Hotel, Lagos this year on policy and advocacy initiatives addressing equitable cancer coverage challenges, solutions, and solutions to enhance accessibility. Mr. Vice Chancellor, sir, the second item in my career is clinical oncology practice, including the embedded fellowship and university teaching. Mr. Vice Chancellor, sir, my oncology practice started at the University College Hospital, Ibadan, in 2007, when I was posted as the supernumerary resident from FMC Gombe. And in 2011, I became a consultant clinical oncologist with 2 fellowships, the national and West Africa. I also went ahead to obtain an MSc in public health epidemiology and biostatistics to support my clinical work and research. And I returned back to Gombe to start a brand new radiotherapy and oncology department, first in the northeastern Nigeria, giving a lot of services like brachytherapy, emergency cancer care, ward rounds, clinic, MDT, etc. I became a visiting lecturer in biostatistics in 2012, and then a senior lecturer and pioneer coordinator, the Department of Radiology from the State University, and I've done a lot of work regarding medical students. I also became a supervisor, facilitator, tutor at the National Open University. And in 2012, together with my colleagues, we were invited by UMTH Meduguri after the establishment of the Veteran Cancer Center, together with my colleagues, to actually support them with most of the advances in cancer treatment. While at the University of Edinburgh, I also was a mentor and support. I provided support for MSc and PhD scholars of the Commonwealth Scholarship Commission and non-students. And in 2012, I supported the first, that's from 2012, I supported the first private university in Gombe State, the Northeastern University, formerly Penn Resource University, as pioneer dean, Faculty of Allied Health Sciences. I was also appointed fellowship examiner, first as an observer for Part 1 and Part 2 candidates in the national. I also support the West African College with update courses. And the third item in my career is health service administration and treatment and training of manpower for health. Mr. Vice Chancellor, sir, I was privileged to serve and learn in different capacities, first as the pioneer HOD, and later I was appointed by the governing board of Federal Teaching Hospital Gombe in 2022 to serve as the Deputy CMAT Research and Training under the leadership of my digital CMD, Prof Yusuf Mohammed Abdullahi. And that gave me a lot of opportunities to improve research and training in the hospital. I also serve as chair for committee establishment of school, like the dispensing of tertiary health information and community health officers. Mr. Vice Chancellor, sir, the fourth item is health services research and research governance. I'm member of international research and collaboration groups, International Society of Global Health, University of Miami, MD Anderson and Toronto, Harvard Global Oncology Collaboration, Pfizer Global Medical Team, and here in Gombe, editorial assistant for Gombe Medical Journal. And I review several journals, manuscripts for journals within and outside Nigeria. Currently, I'm a member of the Health Research Ethics Committee, Federal Teaching Hospital Gombe, and we reviewed and supported over hundreds of proposals and researchers. I served as grant reviewer, Pfizer Global Medical Grants and Global Bridges, Mayo Clinic, USA, with the purpose of improving quality of cancer care in sub-Saharan Africa. I was zonal research coordinator for informed decisions for actions in maternal and newborn health project ideas of London School of Hygiene and Tropical Medicine, and research consultant to PACT Nigeria on leading, learning and documenting opportunities for improved maternal, neonatal and child health services, which actually led to the Bill and Melinda Gates grants of about 1.7 billion in Gombe State. And also my role in expanded community services. I was board member, Gombe State Primary Healthcare Development Agency previously, and also member Gombe State HIV Management Team. Currently, I'm a board member of the State Drugs and Medical Consumables Management Agency, and I've supported my NMA in the Humanitarian Emergency Committee during emergencies, where we have to, whenever there is bomb blast, we have to invite all our colleagues, all cadres, nurses, laboratory scientists, radiographers, and everyone to come actually and support the victims. We worked with policemen, with International Committee of Red Cross, the SEMA State Agency, Road Safety Commission, and everyone, and several community services. Mr. Vice Chancellor, sir, my contribution to practice and knowledge. Over the many years of my clinical and academic practice, I had the rare privilege of seeing and listening to many people, young and old, living and some even dying during the day and at night, under the sun and in the rain. I stayed without sleep for days. I suffered from many hazards, including burnouts and blackouts. I diagnosed and treated patients' illnesses and injuries, conducted several operations. In fact, there are nights I conducted about 3 surgeries. I supported their families, admitted them, and also their caregivers, and educated my patients. I trained my students on the bench, at the bedside, in the theater, classroom, and in the community. I couldn't do it alone. I worked with my colleagues, and I enjoyed the multi-skill, multidisciplinary, and collaborative experience. As a community oncologist, as a clinical oncologist, with colleagues, we treated over thousands of patients annually for the past 8 years, using multidisciplinary and multimodality treatment protocols involving chemotherapy, radiotherapy, brachytherapy, and we did all this to improve practice and contributed to knowledge by presenting the outcomes in conferences, workshops, meetings, publications in peer-reviewed journal books and the rest. Mr. Vice Chancellor, while I was a resident in the University College of Hospital Ibadan and as a consultant in Federal Teaching Hospital Gombe, we looked at the outcome of treatment and we found that most of patients don't actually do well. In fact, people say that cancer is a death sentence, but with community oncology, we want to change that. However, we did some studies to look at why people say cancer is a death sentence. And what we found is that most of these patients do not come on time. They come very late with advanced stage disease. We know they come from far distances. And so by the time they come, they actually don't even have money to afford the treatment. And as such, we tend to have poor outcome. And these are some of the publications that we did to actually show that. And of course, one of the study, I found that I was trying to look at survival analysis, and almost 77% of our patients are lost to follow-up. Of course, they come from very far distances. Mr. Vice Chancellor, sir, we face a lot of challenges, especially clinical dilemmas. A situation whereby a breast cancer patient comes with pulmonary tuberculosis, she's pregnant, or she's actually breastfeeding. This is a very huge clinical challenge that we have to find solution to do that. Another example is CA service patient actually presenting with pelvic kidney, which is an abnormal kidney, and you want to irradiate the pelvis, but the kidney is there. So you have to actually find a way of actually solving that problem. Side effects of radiotherapy, which we've reported like thyroid sclerosis, and all those are difficult conditions that we actually face in treating our patients. Mr. Vice Chancellor, sir, I want to give you a scenario. Patient with cervical cancer and HIV. If you have 100 of them, unfortunately, our studies show that by the end of first year, more than 60% of them will die. And by the second year, more than 80% of them will die. This is actually a difficult situation that we actually have to do more. But when you have community oncology, most of this can actually be solved because they have it very close to them. And recently, due to the impact of COVID-19, I actually joined the International Society of Global Health to actually look at preparedness and response to COVID-19 and pandemic, and we produced important publications. Also, we've also conducted studies with Professor Manga and some other colleagues where we look at the various serotypes of human papilloma virus and compared various screening methods. And we found that especially with the recent vaccination, some of the serotypes that we saw were actually involved in some of the vaccinations, which were very encouraging. As a community oncologist, together with colleagues, and collaboration, we reach millions of Nigerians, Africans, and beyond, especially through social media. We've treated, screened, and educated a lot of patients, thousands of them, some in Gombe. We went to markets, we went to communities, town hall to actually support them, including villages. Through the Papilloma Virus Society of Gombe, we also did a lot. Mr. Vice Chancellor, sir, through my PhD research, we've made some publications. That's my PhD research at the University of Edinburgh. My doctoral thesis or question was, are there roles of communities in improving uptake of cervical cancer screening in sub-Saharan Africa? And I answered that with mixed method research in four study components. The first one is a systematic review of effectiveness and implementation of community-based resources in improving uptake of cervical cancer screening in sub-Saharan Africa. This is for ease of applicability to our region. And I found indication that communities were fully involved and very useful. They led to increase in demand for screening. They led to proximity or access, increasing access to screening and sustainability of screening. And this is actually a conceptual model looking at this facilitators and barriers to actually community-based cervical screening, the increase in demand, access, and sustainability. The second study I did was actually a scoping review to compare the role of these community-based resources. Community-based resources here, I refer to community-based organizations, to religious bodies, to all the community and traditional rulers, women group, volunteers, peer educators, and everyone in the community, whether he's learned or not, as long as he can support in cancer care or in cancer prevention, is actually part of the community-based resources. So I compared that with sub-Saharan Africa and internationally with low and medium income countries. I actually found that the roles are almost the same. However, there are nuanced differences. And then the third study, these are essentially the various community-based organizations I found abroad, usually in the global south. And so the third study was a community-based participant survey of over 2,000 women, which I conducted here in Gombe, for their understanding of cervical cancer and cervical screening behavior. Remarkably, Mr. Vice Chancellor, sir, I found that over 85% of women in Gombe State community, they've never heard about cervical cancer. And that is a big and huge work for us. And one of their characteristics is that they are mostly in the villages, rural areas. They are usually married women. They don't have enough education. They don't use contraceptive services. Some of them even have HIV. Some of the health-seeking behaviors, as we all know, is that some of our women, they actually want to be accompanied to the hospital. They prefer to be screened by women like them. They also need to have permission. Most women need permission to actually go to the hospital, especially for screening. The fourth study was a qualitative study using stakeholder interviews to explore readiness for community-based cervical screening services. And what we found that there was an inadequate readiness of the community. This is one conceptual model that I developed. As you can see here, there is insufficient knowledge and resources, negative attitude and behavior, limited knowledge, and unfavorable contextual factors like high level of poverty, high level of illiteracy, and high level of rurality in our communities. Mr. Vice Chancellor, sir, through Gombe State University, Federal Teaching Hospital, Gombe, University of Maiduguri Teaching Hospital, and all the institutions I actually worked, I had the privilege to mentor, to train, to supervise and facilitate academic, clinical, and research work for undergraduate and postgraduate students, BSc, MBBS, MSc, PhD, and fellowships. Mr. Vice Chancellor, sir, I enjoyed working and traveling across the whole world to learn. To share my contribution to practice and knowledge. Interestingly, Mr. Vice Chancellor, sir, my contributions were well appreciated and recognized. My institution, Gombe State University, my community, the Bojude community, and my students. My university promoted me to the rank of professor. My community conferred me with the traditional title of Danladi Bojude, and my students awarded me with Grand Commander of Northern Nigerian Students. Mr. Vice Chancellor, sir, community oncology is all about collaboration and multidisciplinary practice. Community-based resources for community-based organizations like our traditional institutions, religious organizations, we know most of them have hospitals, they have schools, all can be actually leveraged to improve community oncology services. We have to prioritize awareness raising among married women, those in rural areas. We have to also work and advocate to the State Ministry of Health and State Primary Healthcare Development Agencies to have a robust cancer control plan. Mr. Vice Chancellor, sir, we have to actually embrace e-health, phone calls, text messaging, social media, and so many that we can use to actually increase community oncology services. Mr. Vice Chancellor, sir, most of my community oncology practices were usually through titles, being a president, member, this and that. However, I'm actually coming to the community together with my colleagues and so on. We are coming with the Sahelia project. Women in the Sahel, here is a woman in the Sahel. So it's a Sahelian woman project for community, cancer, HIV, hepatitis, all those things that can cause cancer. We want to help them with that. Mr. Vice Chancellor, sir, the last part of my celebration is appreciation and acknowledgement of people that nurtured me, supported me. And I give all glory and gratitude to Almighty Allah, the ever-living, the sustainer of all, the most gracious and the most merciful. Many gratitude to my blessed parents, family, teachers, and mentors. To my dad, my first role model. an adventurous and enterprising herdsman who ventured out of his age-long career of rearing animals and nomadic life to join the Nigerian Railway, moving to Gombe Railway and settling in Gombe with his family before moving on. And to my loving and kind mom, together with my grandparents and all the extended family for my decent upbringing and support. I'm particularly and immensely grateful to my late uncle, Alhaji Sayidu Sintali Bojude, and his family for his fatherly role, and my late aunt Hajala Arabo Bojude for her motherly role, all through my upbringing and education. And with my blessed parents, may Almighty Allah forgive their shortcomings and reward them with Jannatul Firdaus. I'm also grateful to my big brother, Professor Ibrahim Sayidu Sintali, and Malama Zainab Adamu, to mention a few among my siblings, nieces, nephews, and everyone in the family. To my spouses, Jamila and Asma'u, my children, Mohammed, Aisha, Habiba, Umar, Mustafa, and Ahmad. Thank you all for your prayers, support, understanding, and believing in me. Very special thanks to Jamila for all your sacrifices and inconveniences for being with the kids. Sometimes I have to travel for more than 6 months, more than 1 year. She's there with my children, with my family, and everyone. And also thank you for supporting me, traveling with me across Nigeria and abroad. Let me quote your usual saying, that Allah hadani, the Mejinin Bororo, say in Akuma. Thank you for the understanding and patience in my rheumatic dream. Mr. Vice Chancellor, sir, thank you for being my teacher, mentor, model, and father. Thank you for being there for me and my friends for about 30 years and counting. Through medical school, housemanship, NYS residency training, becoming consultant, all through my academic, clinical, and even becoming professor up to date and beyond. Mr. Vice Chancellor, sir, my whole career centered especially on your visionary and pragmatic leadership and mentorship, especially as the MD, CEO of Federal Medical Center Gombe. I could remember one occasion as a copper after passing primary school in National and West Africa in the Faculty of Radiology. You called me to tell me about your plan to establish cancer center, starting with brachytherapy. And there and then you gave me an employment that when I come back, you will employ me and send me back to Ibadan for training in oncology. I can't ask for more. Thank you, sir. Thank you, Mr. Vice Chancellor, sir. You still continue to mentor us till today. Let me quote a usual Hausa proverb that says, "Mai uwa agende murhu baya cin tuwon sagaya or baya kwana da yunwa." Mr. Vice Chancellor, sir, you are actually a mother to us, and I celebrate you. May Allah reward you abundantly and continue to increase you in wisdom and bless you and your family. To my very supportive professor, colleagues, and pals, Dr. Yusuf, Chief Medical Director, Dr. Manga Provost, Dr. Aminu HOD, Dr. Musa, Director at NICRAT, Dr. Sani, CMAG, Dr. Ali Udin, Dr. Yuguda, DG. Many thanks to you and your families for your support and friendship. And to my teachers in Bojude Primary School, Gomende Secondary School, Bojude, and Bojude Community, notably the Hakimin, Bojude, Engineer Mohammed Ibrahim, and all the traditional chiefs. And also special thanks to Sheikh Hassan Yakubu Mokosi, Chairman, GPU Kwame, being my primary school teacher and inspiring me from the very beginning. To my seniors, teachers, and colleagues in the University of Maiduguri, notably our mentors, Emeritus Professor Idris Mohammed, FASON and Isan Gombe, and our able Vice Chancellor, as well as Professor Abakar Mustafa, former Vice Chancellor, including all the professors, all the leaders of the university and teachers at the University of Maiduguri Teaching Hospital and University of Maiduguri. Thank you and everyone. To my teachers, senior colleagues during my residency program and masters at the University of Ibadan and University College Hospital, notably Professor Obi Campbell. Thank you for being a father and guardian. And here, my teacher, my boss, my mentor, Professor Tajuddin Olasunde, who came from ABU Teaching Hospital and University of ABU Zaria Teaching Hospital just to come and grace this occasion. Thank you, sir. I'm essentially grateful. To my PhD supporters, sponsors, and supervisors, I thank the Commonwealth Scholarship Commission UK, the University of Edinburgh, and Gombe State University for sponsoring my PhD and studying in the UK. I also thank my supervisor there, Professor Christine Campbell and Professor David Weller at the Asha Institute for being with me and supporting me, especially during the difficult moment, supporting me with my family in Scotland. I also thank all the professors there that actually supported me. To my patient, student, colleagues, and staff, and elders at the Federal Teaching Hospital Gombe, I thank my digital CMD, Professor Yusuf Mohammed Abdullah, and all the past leaders and CMDs in Federal Teaching Hospital, Gombe. I also thank our radiology and oncology spiritual father, Professor S.T. Sahad, for his support and guidance all the way. My colleagues in oncology, Professor Musa Ali Gombe, Drs. Abdurrahman Hena Jalo, Chioma Metron Labiga, Mustafa Wami, Dr. Malan Yahaya, Hajja Farida, and all the nurses, radiographers, therapy radiographers, everyone in the department. To my students and staff of the Institute of Health Sciences, I thank the registrar, Alhaji Suleiman Shehu. This guy is not just an administrator, but is also, we regard him as a nurse and as a doctor. He gave me a lot of support when I was appointed as DC Mag Research and Training. Through both research and training, he is immensely knowledgeable and experienced. And I thank all the heads of the units, Alhaji Babagia, the coordinator, Provost College of Nursing Sciences, the coordinators of Peri-Op, Alaji Seidu Abakar, coordinators for Basic Critical Care, Gambod and Fulani, Dr. Kinsley Anoti, coordinator, School of Dispensing of Tertiary, and Jamilu Aliu, coordinator, School of Health Information. I also thank Academic Secretary Malam Usman, Admission Officer Ms. Aisha Sunusi Shehu, Health Resource, Human Resources Hamisu Mohammed, and everyone, including my confidential secretary, Malam Adamu Alhaji, and my driver, Malam Baba Garba, and everyone. Thank you all. And to my students, staff, and Pro-Chancellor of the Northeastern University, I am truly and immensely grateful to the Pro-Chancellor, Dr. Sani Jaro Lalawan Gombe, for his brotherly and fatherly encouragement and support. I also thank the Vice Chancellor, Professor Amuda Yahaya Yusuf, and the Deputy Vice Chancellor, Professor Sani Isiaka, staff and students of the Faculty of Allied Health Sciences, and everyone in the university. To my teachers and mentors and friends in the AOTIC, Africa Organization for Research and Training, Nigerian Cancer Society, NMA, I give special thanks to Vice Chancellor of FUSA, Professor Mohamed Bala Audu, Professor Sani Malami, President NCS, Professor Abakar Bello, past President AOTIC, our own Dr. Sadiq Adamu Abakar, VC Lincoln University, Professor Hadiza Usman, our past CMD, Dr. Saidu Abubakar, Dr. Zainab Shinka, PUICC board member, and Folakemi Odedina, Mayo Clinic, USA. I also thank Professor Ali Malami Diji Nakrat and the current and dynamic president of the Nigerian Cancer Society, Dr. Adamu Umar Al-Hassan. I'm also immensely grateful to the Executive Governor of Gombe State, His Excellency Alhaji Mohamed Inouye Yahaya, CON Amajen Gombe, for my appointment as board member representing the good people of Gombe, North Senatorial District, in the newly established agency for Gombe State Drugs and Medical Consumable Agency. I also thank the Commissioner of Health, Dr. Habu Dahiru, and my board chairman, Professor Ismail Jibrin Kwame, and all the board members and staff of the agency. I also want to specially thank the Commissioner of Works, Engineer Dr. Usman Mejama. Thank you for coming and supporting us, and all the other Commissioner of Higher Education, Alhaji Mohammed Shitimagana, for his support. I also thank Honorable Siti Guba and Honorable Shaibu, all representing the people of Kwame State in the Gombe State House of Assembly. To my student colleagues and staff at the Gombe State University, thank you, sir. Thank you, Mr. VC, and everyone. And many appreciation to the University Ceremonies Committee, chaired by Professor M.G. Duku, our mentor and role model for this very befitting event. I want to end this part with an African proverb that if you want to go far, fast, you go alone. But if you want to go far, you go together. Thank you, everyone, for coming far with me. Thank you for allowing me to stand on your giant shoulders. I couldn't have done it alone. Alhamdulillah, to the ever-living, the sustainer, the most gracious, the most merciful. Thank you, Mr. President.
Thank you very much. Thank you once again for the opportunity. Welcome. Thank you. You can take this. Thank you. You can go and sit. You can go and sit.
Mr. Vice Chancellor, sir, permit me to stand on already established protocol. Start by thanking the Almighty, Allah subhanahu wa ta'ala, for giving us the opportunity, the privilege to witness this day, particularly to appreciate him for the inaugural lecture, as the 10th inaugural lecture, the first, of course, to have a double digit in the university, so making another history. And also coming from the largest faculty in the College of Medical Sciences, Faculty of Clinical Sciences. Mr. Vice Chancellor, we sincerely appreciate you for the commitment and all the efforts in sustaining and supporting this inaugural lecture series. You've never missed any. So far, we've had 10 in the series, and we had no cause, or we have never had any reason to shift anyone after fixing it. We sincerely appreciate you for all the support. Let me also appreciate the ceremonies committee, ably led by our father, the Dean, School of Postgraduate Studies, Professor Muhammad Guramaduku, and for all the efforts in making sure that nobody has actually escaped, his intimidating reminders about inaugural lecture, and even with the effort of previous people to see if they can change, I think it has been all the way a very good effort by that committee, and we hope that will be sustained. Also to appreciate members of the University Governing Council here present, and also other members of the university management and the Senate, all for coming and supporting. Let me also, on behalf again of the committee, appreciate all efforts by everybody who particularly contributed in putting this hall together, and also making sure that we are all comfortably seated to listen to the 10th inaugural lecture. Also to appreciate our visiting Vice Chancellors, Federal University Kashere, Northeastern University, and the Jewel University. Also to appreciate members of the Executive Council here present, traditional rulers, specifically the leaders from Bojude, where our inaugural lecture specifically holds that title of Danladi Bojude. We sincerely appreciate you and appreciate your coming. Also to appreciate our Chief Medical Director, Federal Teaching Hospital Gombe, for all his efforts and the camaraderie that the university enjoys from the hospital. We thank you and we sincerely appreciate all the support. Specifically to appreciate our teacher, our mentor, Professor Olasode, for coming all the way from Zaria to chair and support Professor Bojude in the delivery of his inaugural lecture. We are sincerely grateful, and we know what it takes to travel all the way from Zaria to Gombe, particularly that it's almost impossible to come from Zaria to Gombe with no flight. So it's either you move to Abuja to come to Gombe, or you have to come by road. We are sincerely grateful for that. Finally, to specifically appreciate the family and friends of Professor Bojude, most importantly his spouses, for all the efforts and support in making sure that Professor Bojude becomes what he is today. We cannot thank everybody enough, and it's not possible to list and mention everyone, but we sincerely appreciate you for coming, and we sincerely hope and pray that our next inaugural lecture in September will also get your support and attendance. Thank you very much. God bless. Thank you.
Thank you very much, sir. Professor Mohamed Manga, the Provost, College of Medical Sciences. You are welcome. We have come to the end of this program. We are going to take the national anthem. After the national anthem, the Senate will move out in reverse order. After that, the other guests will follow. We thank everyone for coming. Thank you very much. The national anthem, please.